Officer for the online program, and Dr. Albert Wu, Program Director.
Hello.
Myself, my name is Angelica Santiago. I'm an admissions officer here. I work specifically with our online applied science program. This is one of the programs that was started last year through the university. So we are now preparing for our second cohort in fall of 2018 now. I've been in online admissions for over 5 years now, and with the online programs here at Johns Hopkins the past 3 years. Dr. Wu, could you please introduce yourself to our audience this evening?
Yeah, right next door to Angelica. I'm Albert Wu. I'm an internist, though these days I'm really mostly only an internist on Fridays. The rest of the time I'm a professor of health policy and management and medicine in the Johns Hopkins School of Public Health and School of Medicine. I run our PhD program in addition to this master's program, and I am a member of our Armstrong Institute for Patient Safety and Quality. I also, what am I doing that's interesting? One of the most interesting things I'm doing lately is I'm the new editor-in-chief of a new patient safety journal, the Journal of Patient Safety and Risk Management. We have our first issue is out this month, so that's been a fairly consuming activity, besides looking at applications for this program. I've also spent time in Geneva at the World Health Organization, and most of my research is either on patient safety, healthcare quality, or patient outcomes. So I am very excited to be able to join you today, and I think this program is really innovative, as you will hear more from both of us.
Thank you. Well, just to go over tonight's agenda, Dr. Wu will be giving us an industry overview, discussing the industry as a whole, the reasons why this program was designed, as it is a first of its kind with a collaboration with the School of Public Health, our School of Medicine, School of Nursing, and our Armstrong Institute for Patient Safety and Quality. He will then be talking a little bit more about the program details and going on to discuss the curriculum, a little bit of insight into year 1 and then year 2 of this master's degree. He'll go over what it looks like to be in online learning here at Johns Hopkins, what you could expect, sort of the interdisciplinary collaboration of this program, and the faculty then that are involved in the program and would be teaching our cohort. I'll then go over our admissions requirements and financial aid and tuition details. And if you have any questions along the way, chat box, and we will be sure to answer them at the end of the presentation, as we're going to leave some time for Q&A. So Dr. Wu, you want to go ahead and get us started?
Sure, and again, if you have questions, type away. There are actually 3 of us who are minding the chat box, so one of us is bound to be able to pick up on your questions or comments, and we will respond promptly. So my colleague, Peter Pronovost, who was until just very recently formerly our Senior Vice President for Patient Safety and Quality in the Johns Hopkins Health System and the Director of the Armstrong Institute, he said that organizations profess patient safety as a top priority, but are still figuring out how to that they do for their budgets. And this is, in a way, some of the motivation behind what many of you are doing and what we are about. You know, most of you, just about all of you, work in healthcare, and healthcare organizations are actually pretty good at managing their budgets. There are hordes of accountants who pay close attention. There are very frequent reports, and they manage it in such a way that they, for the most part, hit their targets every year, every quarter, and are thereby able to fulfill their other missions. You do need money to run things. But this is not traditionally what we have done with patient safety or even healthcare quality. And as perhaps evidence of this, there is data dating back to the 1990s, but some studies right up to the minute that suggest that on average, 1 in 10 people who are hospitalized for an illness or surgery wind up getting harmed in some way or other while getting care. And this is true in the United States, it's true in Europe, and it's true just about everywhere that it's been looked at. Medications are unbelievably common. There are probably, in the US alone, there might be 6 billion prescriptions written every year. And every year there are at least 1.5 million preventable adverse drug events, that is harm caused by medications in the US. This doesn't come cheaply. Estimates suggest that the costs of medical errors, harm from procedures, from misdiagnosis, the cost of tests that really didn't need to be done, legal payouts for malpractice. This is not even counting disability that people suffer. The cost of these are in excess of 100 billion US. Recently, we have sort of realized that inaccurate diagnoses are perhaps even more common than medical errors. They're a little harder to pick up, but they may be the most common of all medical errors. And they often have catastrophic consequences. So all of these issues suggest the need for this course, and in fact, this whole degree. We're really at an exciting time. I think that just in the last 5 years, really many frontline clinicians and their managers have developed an enthusiasm and a real commitment to improving safety. These are people who believe that patient safety is part of their job. And many people are in positions now, virtually every hospital. At Johns Hopkins, the Armstrong Institute employs about 140 people. The problem is, though, that in most situations and in most hospitals, honestly, there is not the expertise, the training, the scientific background in sort of the many parts of what makes up the science of safety. How to think about safety, how to design efforts to improve it, how to analyze those data and know that you're doing better. And it makes it difficult for frontline workers and people who are trying to lead safety to be able to be successful in leading those activities. But nonetheless, physicians, nurses, physical therapists, pharmacists, technicians, many kinds of professionals are important in patient safety. They know best about the work that they do. They are really the experts in their areas. And this necessarily is a very, very multidisciplinary specialty, if you can call it that. And so there's a place for many different kinds of health professionals. There are now all of these job titles that people are filling. Director of Quality Management, Patient Safety Officer, Medical Director, Nurse Director of Clinical Quality, Risk or Quality Improvement Director, Director or Vice President for Quality Management, Director or Vice President of quality and outcomes, quality assurance, patient safety, vice president of performance improvement, patient safety officer, patient safety consultant, my colleagues in the field, and indeed even some of our current students hold these titles. But many of them are going back now to catch up a little bit on the science behind what they do. So what we have here is something which I think there's been, our program I think fills a gap that we realized just a couple of years ago exists. We have a PhD in health services research, and some of our students focus on safety and quality, and after they get an undergraduate degree and perhaps a master's, they spend 4 or 5 or sometimes more years getting a PhD in patient safety. But that's not something that people necessarily have the time or interest in doing. We teach an online free course. It's one of these Coursera multiple online, massive open online courses, and it's all free. But it's hard to teach sort of the practical skills that you need in a free course that has a limited number of lectures. We have a certificate, we actually have a couple of certificates in patient safety and quality, but you either need to be enrolled as a student, or else it's difficult to sort of teach enough material, again, for someone to be able to say that this is really a credential for their work. So what we realized we needed was a very practically focused, sort of skills-based training program for people who are working. For that reason, it needed to be less than full-time and available online, because not everyone lives in Baltimore. So what we put together is a 48-credit academic credit course, which is taught for 4 terms in each of 2 years. At Hopkins, we do things by quarters. Besides courses, there are other opportunities for professional development, and there's an integrative activity at the end of the course, towards the end of the course, to help you pull together what you've learned. Besides lectures, there are group exercises. There are some peer assessments. I think that we often learn best when we're not necessarily teaching, but judging the work of others. And the course is very skills-oriented. Every course includes projects, skills which we are directly trying to impart, some hands-on kinds of training. This is really sort of a public health focus. It's not simply a inpatient health degree. And I think the idea is to think a little bit more broadly, to think about things that aren't quite so traditionally medical, including measurements, thinking about systems, including systems that extend outside of health systems, to think about organizational behavior, to think about culture and microculture, to think in a patient-centered way, and to think in a way that really emphasizes prevention. So here's the curriculum. First of all, there's actually quite a nice orientation to the online learning platform, which I think we're all pretty happy with. In the first year, which is 24 credits, there are, and I will say that there are some requirements which don't seem like they're strictly patient safety, and that's because this course is fully accredited by the Association of Public Health Schools. But so in any event, there's a required ethics course, simply to have an introduction. There's a foundational course on the quality of care. What is it? How do you measure it? How do you improve quality? There are some seminars in important issues in public health. And so those 3 courses, really 2 courses, are the first quarter of the year. In the second quarter, we have our foundational course on the science of safety. And we have what I think is wound up being a really fun course on case studies, on some best practices, both in the US and internationally, on organizations that are doing a good job with particular aspects of quality assessment, quality improvement, and improving safety. You need to have some basic skills. So in the third term, there's an introduction to epidemiology. There is a workshop, which is basically on professional development, which I think can help anyone with some of the nuts and bolts of dealing with work in our organizations. In the fourth term, there is a first course on statistics. It's not a mathematical statistics course, but it's important to have a basis of statistical concepts in public health. And there's a really exciting course on leadership, which is taught by a couple of faculty here at Hopkins who are in fact themselves world leaders in teaching about leadership. In the second year, the first term, there is the second quarter of biostatistics, and then there's a fun course on quality improvement tools which we believe that some of which many of you will have some or others of these tools, but there are some of the tools include how to run a comprehensive unit-based safety program, the team steps training. There's a block on Six Sigma or Lean Sigma, and so forth. In the second term, there's the second quarter of epidemiology and seminars in public health. So this is not the second term is not a heavy patient safety term. The third, there is what is a great course that we teach a version of in our on-site full-time public health course on measurements and evaluation, in this case in quality and safety. And there's a course on infection surveillance and control, which is crucial in all hospitals. In fact, this is not even a course that is taught as part of our academic patient safety course. Maybe we should adopt it in the future. In the fourth term, there is a fair bit of emphasis on an integrative activity. Every student have already identified and works on it with some supervision to try to develop a project, to investigate an area, to in many ways take what has been learned in the previous 7 terms and put it to use. And finally, there's a measurement lab, which we haven't taught yet, but which looks very promising, and doing some of the things, including the dashboarding that is, so much a part of every institution these days. You'll get a chance to actually get your hands a little bit on some data in a moderate way, so that you are more familiar, at least, with how to be able to demonstrate that things are, in fact, getting better as opposed to otherwise. We can get the next slide. Perhaps we can get the next slide.
Oh, yeah, give me just one.
That looks so much like the last slide.
It looks like you should be able to view it now and finish discussing the interdisciplinary approach to the program. Sorry about that.
Oh, no problem. So this is actually perhaps the most collaborative course that is taught at Johns Hopkins. It includes faculty from the School of Public Health, but also from the School of Medicine. There are actually 3 co-directors, until quite recently Peter Pronovost, Laura Morlock, who is the Chief Academic Officer in the School of Public Health, and also an organizational sociologist, and myself, but also the School of Medicine, the School of Nursing, and in fact, some faculty from the School of Engineering. All of our lecturers are experts who are working nationally and internationally on research and on actual practice of safety. And I would say that more than one of our number are leading authorities. Over 20 years of teaching online courses. We have perhaps a total of 150 online courses. I think we're pretty clearly the industry leader in this area. And as a result, over the years, we have been able to put together course materials with really high production values, so that you don't feel like you're looking at one PowerPoint slide and then another PowerPoint slide and then another PowerPoint slide. And I think you'll find that the material is pretty engaging. The faculty have recorded and then had edited and prettied up who are perhaps not in this time zone or who are working at the hours that one might be lecturing live, the flexibility of being able to view them at any time and to review them for that matter. There is also a help desk, which is available actually really 24/7. Again, that is helpful if you happen to be in a time zone that is different than Baltimore. And indeed, we do have students in pretty much all of the time zones. It's pretty remarkable. So some of our faculty, I teach our patient safety course, and I'm serving as program director. But we have some, we really have a terrific faculty, and I will not name them all. But I'll point out a few just because, not because they're all illustrious, but not just because they're illustrious, because they come from different disciplines. Melanie Curlis is a nurse, but is really an infection control specialist. And I venture to say that she knows as much about infection control as anyone on our faculty. Renee Demsky was trained as a social worker, but now is acting director of operations for the Armstrong Institute, and this is for operations of everything related to quality and safety for the entire health system. Cheryl Dennison is a nurse who is a patient safety researcher. Hanan Idris is got her doctorate here at Johns Hopkins, and she was actually my advisee. And she is now the director of safety at Children's Hospital in Riyadh for the National Guard. Over in the other column, Jill Marsteller is an organizational sociologist who really brings a different way of thinking to the course. Laura Morlock used to run our program for hospital finance and management, and is now Senior Associate Dean for the School of Public Health. Director of Patient Safety for the hospital. Peter Pronovost, who is still an associate on our faculty, He actually eloped just in the last couple of months in healthcare, but will still be appearing for some of our lectures. Is one of the world's experts in patient safety. Mike Rosen originated the Team Steps program for the Agency for Healthcare Research and Quality, which is probably the most widely used team training program certainly in the U.S. Kathy Sutcliffe is perhaps the world's expert in high reliability organizations, and is helping teach our leadership course along with Mike Rosen. So I could talk more about more of our faculty. They're all terrific and well published, but also actually out there practicing on the operations side of safety and quality, as well as the academic side. So what do you need to get into this program?
Well, thank you so much for that information so far, Dr. Wu. At this point, I will be going forward to discuss the admissions requirements. Good questions coming in. So, Dr. Wu, if you can stay on standby, that way we can make sure to get to our Q&A session here shortly. So, for admissions requirements, all of our applications for this program are processed through the SOFIS application portal. It's an online application portal specific to public health schools. So it's a centralized service that you would have to go through online. Requirements is that students do have a completed bachelor's degree from an accredited college or university, and a minimum of 3 years related. That work experience does not mean only clinical within the health field, which we will ask Dr. Wu to expand upon in just a little bit. You will have to submit a current resume or CV discussing some of your previous work experiences, any healthcare related accomplishments included. 3 professional letters of recommendation are required. Now, these can be a combination of academic and professional recommendations. They can be only professional recommendations. There's not a requirement on the balance of that. That is per the student that is applying what is best to strengthen their own individual application file and who's going to be best to ask. You'll also have to write a statement of purpose. So this is a great opportunity to make sure that as the admissions committee is reviewing your file, they understand how the educational objectives and competencies of this program relate to your career goals and your interests. And last, for any students we have that are joining us that have education that has been received internationally, you will have to have a course credential evaluation done by the World Education Services and a proficiency in English exam either through TOEFL or IELTS. Additional admissions information that are important to share with the upcoming deadlines. So the application deadline for our program this year will be Sunday, July 1st. Students are enrolled one time per year. So while there is flexibility while you are in the program to go at the 2-year schedule or to expand that a little bit, you can only be enrolled and start the program in the fall, which this year it will start on Tuesday, September 4th is when classes will begin, the first day of class. Our applications are done and reviewed on a monthly basis, so we do encourage students to apply early. If you feel like you are connected to the material you've been hearing so far, there will be some links you can go look at to connect with myself or someone in the admissions office. That way we can get you some links so you can start on the application. But because those applications are reviewed by our admissions committee on a monthly basis, you can receive your decision soon and start planning for the fall properly. For financial aid and tuition information, the 2017-2018 tuition shows that it is $1,091 per credit hour. Our tuition rates are assessed each spring for the following academic year. So stay tuned to our website. There will be an update to that here within the next couple of months. But more importantly, we also have a scholarship available that is specific to our online applied science degrees. That scholarship per the 2017-2018 tuition rate states that the tuition will be reduced by about $419 per credit. That students will be left with the remaining $672 per credit as their responsibility through the program. And there is a total, as you saw with Dr. Wu, that there's a total of 48 credits in the program. The admissions application for this program does serve as your scholarship application, so there is no additional forms required. If you are admitted to the program, once you are reviewed by the admissions committee, if you're admitted, you would receive with your admittance decision that information regarding the scholarship that you have obtained. And beyond the scholarship that we offer, if you need additional details on financial aid, whether it is assistance through federal or private loans, you can definitely jot down the information here. It's the phone number and the email for our financial aid office. Now, there's already been quite a few that have come in. I think we're going to start off with a popular one. And Dr. Wu, I'd like to direct this to you first. I think this will also give a chance to shed some light into our current cohort. They're asking if students can be from a non-clinical background. So is this program designed for only students with a clinical background? Are there students in this program currently that have non-clinical backgrounds? Dr. Wu?
So great question. And our curriculum is designed to be broadly applicable because we understand very well that it takes all kinds of professionals to actually execute a program in patient safety. So on the one hand, this year we have 48 students enrolled. And if I count correctly, something like 20 of those are actually physicians. So that is so there is definitely a chunk of folks who are physicians. I would say another perhaps 15 have a nursing background. But then beyond that, there are people with all professional positions and professions. There are pharmacists. There are program coordinators. There are innovation coaches. There are research coordinators. There's a clinical customer service representative. There are physical therapists. There's a lactation consultant, but all of these people in particular there's an executive strategist. All of these people are, in particular, those who are not physicians and nurses. Most of them are already working or aspire to work in patient safety, and interestingly, many of them have backgrounds which are not particularly medical. There are people whose degrees are in anthropology, in mathematics, in plain vanilla liberal arts, in kinesiology. There's an electrical engineer. There are medical technologists. There's an English major. There's a women's studies major. There's a sociologist. So there are many people from many educational institutions. And they really run the gamut in terms of size, geography, and the extent to which they are sort of the most traditional academic institutions, and others which who are simply providing bread and butter education for people who ultimately realize that they ought to be doing patient safety. I would also say that we have more, that while the majority of our students are from the US, we have a real international group. We have Canadians, of course, who Colombia, we've got someone from Egypt, we've got someone from Taiwan, the Philippines, Liberia, Vietnam, Nepal, India, Argentina, Australia, Kenya, Philippines. It's really a nice mix of people. And those students who you also will learn from have a lot of experiences which, it's simply really beneficial to be exposed to. So it's quite a diverse group in every way, I would say in age, in gender, in geography. We've got some students who are in their 50s, one who I think is even in her 60s, and we've got some students who are, I don't think anyone's below their 20s, but they're students in their 20s.
Well, thank you. I think that was a very thorough answer, and I can't reiterate enough, being in admissions, that we constantly talk to students that are both with clinical and non-clinical backgrounds, since there are a variety of roles.
It's kind of inspiring to read applications. I think that, you'd think, oh, everyone at Johns Hopkins is a snob, but there are amazing stories that people write about. There are people who, because of a variety of factors, were not initially absolutely the most academic students in their cohort. They were not destined to be surgeons, and some of them did not become surgeons, but many of them realized the need for the importance of quality and safety in their work, and have risen to leadership positions within their organizations and within their specialties, and now realize they need more training to do a better job and to actually lead some of this work.
Thanks. Well, I think I can take the next question, Dr. Wu. So the next question is regarding the program, if students are able to extend. So it is scheduled as a 2-year, taken every 8 weeks. Students have the summer off, and they continue on to the second year to do 2 classes every 8 weeks, and of course that runs from September until mid-May. If that schedule, the time commitment, if you are pursuing that schedule, should roughly be about 18 to 20 hours per week. However, if that is not the appropriate schedule for you based on other work commitments or personal commitments, students have up to 4 years to complete this master's degree. So we do have some individuals in the program currently who have work schedules that do not permit them to add on an additional 18 to 20 hours a week. And if that's the case, they are going to take 1 class at a time every 8 weeks and will finish the program over 4 years. As far as the time commitment, Dr. Wu, the feedback that we've gotten from students this year was about 18 to 20 hours a week on average. Could you just give a few more details as far as how students are assessed, if they can expect tests more, or if they can expect more on written assignments? And just some light into what it looks like on a week-to-week basis on average?
Yeah, so there are a variety of assessments, but I think that most of the courses, as opposed to having one big exam or one huge paper, have a number of small assessments throughout the course of, sort of the 8-week term. They might be sort of assignment to do a small quiz, or to complete a project, or to read something and submit a review. There are often papers at the end of courses, but they tend to be actually sort of perhaps a with no paper, no course will accept a paper that is more than 10 pages, double spaced, with 1-inch margins and a reasonable size font. So we're not looking for people to write books.
Perfect. And would you reiterate that you feel like this is more of hands-on and application versus a heavy testing environment?
This is really not a heavy testing environment. Some of the quizzes during the term, for example, for the patient safety course, are open book quizzes. The assignment at the end of the course is to take a problem that you're interested in and describe factors that might make it either more or less likely to cause harm, and think about possible solutions. We think that all of even the assessments are very practical. They're things that you might need to do, you're very likely to need to do as part of your work.
Perfect. I think another good question came up regarding they wanted to confirm if there was Lean Six Sigma covered, as well as if there was opportunities to talk a little bit more about leadership. So I can reference back to that slide just so students can see what you were talking about a little bit earlier. I'll just be clear, and then Dr. Wu can expand upon that. When you're looking at leadership, innovation, and sort of managing the transitions that come along with patient safety and quality, and really being able to understand more of how to help develop that culture for patient safety, that course would be Leadership for Change, and it is in term 4 in year 1. And then in year 2, there is a Quality Improvement Tools course. Team steps, CUSP, a couple of those interventions will be discussed. Does that sound about right with the curriculum? Dr. Wu, do you have anything you'd like to add to that?
Yeah, so Lean Six Sigma is covered in the course, though. If those of you who have done this seriously realize that everyone's not going to come out a black belt, just based on a 8-week 3-credit course that's covering sort of after you've finished this course.
Perfect. I think another good question that came up was in regards to students that are interested in sort of the networking that comes with a program like this. Do you feel like there is the best opportunities to network with their colleagues? What will their interaction be with the other classmates that they are in classes with?
Yeah, so because everyone sits in a different place, I think the interactions are basically online, but most of the classes have some or other projects that involves a group of students, so you certainly get to interact with your fellow students. Even there are live lectures in all the courses that sort of there are 3 faculty, and for that matter with each other. Those last for an hour or more, and those are very interactive. I see that I've observed that the people who are on those live chats appear to know each other by the time they've gotten to me, which is in the second term, that second term course, and are obviously interacting already on the various online sort of bulletin boards and chats that we have, sort of discussion boards that are part of all of the courses too. So we really try to, just to give an example for the patient safety course, we ask people to introduce themselves, we ask them to introduce problems, we encourage students as well as faculty to try to help problem solve online, and there are some terrific discussions. I think some of the best discussions I've seen in any course in that I teach online or face-to-face have been in the last year in this particular master's course.
Perfect, thank you. I think I can take a question. There seems to be a lot of individually based questions regarding TOEFL requirements or WES evaluations. Some of these items are on a case-by-case basis. If you can feel free to, and anybody can with any additional questions. My phone number is here on the last slide, as well as my email. I do want to make sure students know that some of this information is probably better discussed with you one-on-one. That way we can give you particular details there, and send me an email directly after this presentation so we can make sure to get those questions answered in detail, especially if you are considering the application process. Dr. Wu, I think we have a question here. And I think you kind of discussed it earlier, talking about the background of the students. Is there any concern with students applying if they are not in the U.S.? Is this applicable to both students in the U.S., out of the U.S., and how has the experience been for our international students so far?
Yeah, we actually have, we have a little bit of a U.S. focus, but at the same time, in the example for our case histories course and for our other courses, we try to have examples from non-U.S. sites. We have cases and problems and actually systems that are outside the U.S. In fact, one of our faculty members is based in Saudi Arabia and is able to facilitate some discussion with some of our Arabic students. And in particular, the cases course includes several cases that are from lower middle income countries outside of the U.S.
Perfect, thank you. Just for students who weren't able to hear earlier, we had some questions on the letters of recommendation, in particular to the admissions process. Those references can be from peers. There's always a suggestion to definitely make sure that there is a supervisory level as well within at least one of the letters of recommendation. And they can be from former professors, academic and professional references. So great question for whoever asked that. You can definitely, there's a variety of different students based on their level of education, how recent their last degree was, if they have the opportunity to get an academic letter. It's not required, but it's definitely welcomed, as well as any recommendations from your peers, as long as there is a supervisory or something from someone who you directly report to. In something of that nature from your career. Dr. Wu, I think we have some students.
Yeah, great question. So this program is, I would say that this program is more practically focused, and it's more focused on patient safety and healthcare quality. The MPH which is a terrific degree, has almost twice as many required credits. It can be done online or in person, but some are the requirements for things that aren't particularly quality or safety are heavier, particularly for biostatistics, for epidemiology. There's requirements to take things like environmental health, which are certainly important, and which might go as a credential if you were aiming to be a public health officer. Then the MPH is a credential for certain positions. This is less intended to provide a credential than it is to provide practical training. I think that there is, to this point anyway, there are no jobs that require a patient safety degree or even a patient safety certificate. Though I will say that patients have said that because of the work that they did at Hopkins, that this is more practical. The tuition is perhaps half the tuition of the MPH, and there are fewer credits, and it's more focused.
Perfect. Thank you for that answer. At this point, we are going to go ahead and bring the presentation to a close. Dr. Wu, I want to thank you for your time you spent with us this evening and all the elaborative answers you've been able to share with us so we could gain more insight into the program. Anyone who has any remaining questions that we were not able to answer, please do take down my details so we can connect with you personally sometime during the rest of this week. Keep in mind, everyone who did attend, if you were able to sign in but you signed in a little bit later, this presentation will be emailed to you within the next couple of days, and no later than next week you'll get a copy of this presentation with the slides available to you in your inbox. And really at this point, if you feel connected to the material, what we strongly encourage you to do is to start your application. Creating the application in the SOFIS website is a very easy step to do, and in the office we are here to guide you through that application process so you can be reviewed early. So again, thank you so much, Dr. Wu.
Oh, it's my pleasure. We're really excited about this, and we've already accepted maybe up to 10 students, so we're already on our way.
Very exciting. So thank you for everybody for joining, and we will look forward to seeing your applications and seeing your questions come in soon, and I hope you all have a wonderful night.
Take care, everyone. Have a good night or evening or wherever you are.